here's pretty much our wound care station, and what we have for the supplies are very important things that have been donated to us. Pretty much what we do and start out with is good water. If we can get bottled, sterile water is the most important. Otherwise, we go to the village and we'll have them get their best water and then boil it. So this is actually boiled hot water in there. So we have, say, water in this one, and these syringes work great where we're able to suck up the solution and then be able to squirt it onto the wounds, or you can actually even tap it onto the wounds drop by drop, or use your hand and do a real violent flush to get a lot of sand out. So that's a water. This one here is the HybaCleanse. This is a great cleaning solution. We pretty much use these drapes underneath the wound, lay those out, and put the leg or the arm on these, and then use a towel is a great way to do it. Just get them wet with the water or the soap solution, and then just really scrub them down, all the extremities around the sore. That's real helpful with these type of towels. Little sores, we can do just small 2x2 gauze or on up to the larger gauze. Then we also have hydrogen peroxide, and 50% hydrogen peroxide, 50% water, and that works for an initial wound cleaning. You don't want to use hydrogen peroxide on serious sores that have lasted for a while. It's a good initial wound cleaning agent, and it causes it to bubble real well too. And then we also have a soap and water solution. So a lot of these are just mostly cleaning agents, but this is the most important. And for serious staph wounds, we pretty much have a prescription for Physahex, and this material will actually dissolve scabs. So the most ideal is to clean up the area first, then we go ahead and drop drops of this onto the scab area and cover it with gauze and let it sit for a while. You can actually work it in a little bit, and after about 5 or so minutes, you can actually lift off the scab with this material. So it's a great material for staph infections. Then after the wound cleaning, we'll flush it with good water, and a lot of times we use triple antibiotic ointments that have been donated. There's also, that's for, say, real dry, crusty type scab wounds or wounds. This here is excellent polysporin powder, which is perfect for rainy days and especially for Samoa, because this is a powder triple antibiotic ointment which keeps a wound real dry in the tropics. Then a lot of times we use this Coban tape. This is excellent wrapping material for around here, just like an ACE bandage material. Pretty much put your gauze over the wound, and this is much better than doing band-aids. Band-aids don't seem to stick very well in humid areas, so we can do it this way with a Coban tape, and this stuff actually sticks to itself. So you pretty much cut that off and the patient's ready to go. And the Coban actually comes into different sizes. So we get a lot of real large wounds. So this is very large material here, and versus the smaller size version of the Coban. Okay. We'll use triple antibiotic ointments. We have anti-itch creams. Very important for the tropical regions, jock itch, other foot itching problems. A lot more antibiotic ointments. Good assortment of Band-Aids. Again, they don't work as well in the tropics, but if you can get a hold and use these cloth type Band-Aids are the best. The other ones that are plastic on the outside do not adhere as well, but this is an actual cloth, and it sticks on a wound very well. You can tell already. So pretty much we'll give these Band-Aids away to the people when they go home, give them a good amount of supplies. Kitty Band-Aids, for those that like to cry a lot, it helps to put a colorful Band-Aid on them, and then they can go home. A lot of anti-itch creams, again, hydrocortisone creams. We have a good assortment of large Band-Aids, and these can cover large staph wounds. So the more of these, the better. Next Care Band-Aids that are available at Costco are excellent Band-Aids. Definitely finger Band-Aids. We've seen a lot of ingrown toenails, ingrown fingernails, so these are perfect for those. And definitely wide Band-Aids. The wider the better pretty much for around here. Don't really use too much of the small band-aids, but they're available for little tiny sores for kids. And then we also have some round ones that work for little zit kind of things or ulcerations. Now these here are also very important. These are good hard tip Q-tips. When we use that FISA hex to clean out a real bad staph wound, we can actually get in there and dig and scrape and actually get the material brought out. Now another thing that's very helpful, Samoans don't have a whole lot of hair on their body, but if there was a sore right here, you'd want to shave off the wound area because there's a lot of bacteria contained in hair. So do that first during the actual washing process of the wound. Another thing very important are these the antifungal creams. There's a lot of things called tinea versicolor, athlete's feet, jock itch. So this is very good stuff, and we didn't have very much this year, and we need more of that in the future. Then a lot of good supplies, gauze wraps. Put the gauze on the wound. You can send them home with this type of a wrap and save our Coban, but they can work with this stuff very well. And then give them some rolls of tape. We have a good assortment of extra tapes here. So they can make this stuff work themselves. But Coban's really the best material. Then we have some good assortments of muscle rub for a lot of these elderly, older, heavy-set type of people. They get sore muscles very easy, their knees. So this is great. Bengay is another good product. Some tongue depressors are good. A lot of times we'll give them take-home type of ointments in a pill bottle. They can actually go ahead and use these tongue depressors inside a Ziploc bag or whatever and actually pull their material out of there and then dab it onto their wounds, or the Q-tips. Lots of good Q-tips. These are those hard Q-tips. A lot of good gauze wraps. Very important to have these on a wound care station. A lot of sterile gauze wraps for those real serious wound cleaning we want to do to take good care of bandaging their material. We always use gloves at the very beginning of the station, so we always have a good assortment of surgical gloves. And worst comes to worst, you run out of bags, you can always squirt antibiotic ointments, any other materials inside these little fingers, tie it up, and then they can go home with their solution inside the rubber gloves. And then over here we have a lot of sterile gauze wrap, gauze bandages. And these are excellent for when we do our wound cleaning. We want to put the cleanest sterile material on top of the wound, and then you can put another gauze material on top for a pressure or a covering. So we always want to try and save these and use these as best possible on the wound itself. Good sterile wraps as well. We also have good sterile sutures. We have the scalpels. At times we do suturing. We also have good equipment and supplies here, utensils, and we usually have a bottle or a container that once we use these, we can have them soaking in alcohol or bleach. Definitely some baby powder is very important for a lot of the babies have the itch, the fungus, the just overall diaper rash material. We also have good cleaning agents with Providine type ointments, iodine, and our alcohol is great for cleaning utensils, wiping down areas, sterilizing them as well. Don't do very much with injecting diabetes medicines or anything like that. Hydrogen peroxide, of course, works real good, but only for the initial cleaning. Trying not to use it for anything after the initial cleaning because it does destroy and eats the tissue that's healing. Always diluted 50% though. And every now and then good soaps, our hand soaps for if we want to do surgery on people. And another very important item is Head and Shoulders and Selsun Blue shampoo is excellent for the tinea versicolor, the fungal problems all over the bodies of these people. They have these white spots. and just using it as a lotion in the morning and in the evening is very helpful. Also, we have tablets of ketoconazole, which works excellent for internal cure for the tinea versicolors and athlete's feet. We need a lot more of that as well. So that's pretty much basically the wound care station and setup. The most important, the initial good cleaning agents like HybaCleanse and the FisaHex takes care of a lot of the staph infections here in Samoa. Okay, cut.
Yes, that's what you got to start off with every time.
And finish up with.
And finish up with.
Okay, so tell me about this stuff.
I don't know anything about it. Well, this is the material which is very, very important here, because spreading of the germs is probably one of the worst thing you can do. This is why we try to use this before we start a job. All you got to do is put it on there, make sure you're all nice and clean, then you don't have to worry about spreading any of the germs that you do. So when we go to do a cleaning or anything, we first of all get some nice rubber gloves. After we sterilize our hands, we put the rubber gloves on, and then we are ready to go and treat the patient. We don't want to go and spread the germs either to ourselves or to the patient. So we put a rubber glove on both hands. That way we are sterile and we are clean. And we try to stress most of all to keep the things clean. We have different kinds of tapes that we also use to help hold even the Coban on. If this is on the leg or arm, you can then just take a little piece of tape, put it around the top, and then that'll hold that to keep that from unraveling even further. Again, we try to use all the processes we can to keep that wound clean, and to give these materials to the people. We sometimes have a baggie that we can put the material into. Give them the Q-tips that they need if they have to go and apply the stuff on the outside. Or what we also can do is give them a tongue depressor, of which they can dig the material out of the bag and put it on their skin. Sometimes they just need a little support, so we have a few ace bandages. They seem to most of the time be few and far between, but a lot of times it just takes a little relief with an ace bandage if somebody's got a sprain or a twist. That'll really help them. Well, we have all the different kinds of swabs and things, and Q-tips, and we like to have containers like this that we use a lot of our stuff in, and basically cleaning up. We take our materials, dispose of them all into a bag, then re-sterilize our hands with the Germ-X solution, so that we don't carry any germs which we may have come in contact with the previous patient to the next patient. That's about the size of it, and we try to do our best, and with the help of the good Lord, they'll get cured and saved.
Here's your reward.
Oh, thank you, sir. Oh, I'm so happy. One I've always wanted. This is the one I had in my dream picture.